until we get to very high levels of people being fully protected against COVID-19, it is not yet safe to open up our borders, because what we know is as soon as we open up the borders, we will have more COVID-19 coming into Australia, and we will have much more cases occurring in Australia amongst those who have not been vaccinated. Phase D is when we open up completely and we're accepting that there will be people coming and going with COVID-19 in Australia. We're not yet at the point of understanding what that will look like. As we move through each of the stages, and as we get more and more evidence about what's working and what's not working and real life experience from both what's happening in Australia and in other countries, then we'll understand more about when we can move to phase D. So we're doing assessments continually of many other countries and how they are responding to COVID-19. We're looking at levels of vaccination in those countries. We're also looking at the public health measures in those countries. We're looking at the capacity of those countries to be able to test their population and to understand what the baseline level of infection is in their countries. Obviously, some countries have a much stronger public health system than other countries. Again, we're looking at the ability of other countries to do those tests and provide accurate results to other people. South Korea has been a country which has managed COVID-19 very well throughout the pandemic. Yes, it's had some outbreaks like Australia has had, but it has a very strong public health system. It was very quick in introducing testing. It's getting its vaccination rates up as well, just like we're doing here in Australia. There are multiple factors which need to be looked at, and it's how the country is coping and what the trends are, whether the trends are up or down, which are just as important as the absolute figures that we might see. For people to go into home quarantine, you would expect that they would be fully vaccinated. You would expect that they would have had negative tests before coming to Australia, but also they need a home environment which is going to be safe, which means they're not going to be at risk of transmitting COVID-19 to other people who may be in the household. So what we don't want to see is someone comes in and then their entire household is infected with COVID-19. It's about 14% of all cases of COVID-19 have been in children aged 12 and under. We have seen more children infected this year than last year, and this relates to the Delta variant. And what we're seeing with the Delta variant is much more spread among family members. We're seeing more children who've been infected. Fortunately, COVID-19 is usually a very mild illness in children, but we do see a small percentage of children who end up in hospital and a very tiny number of children who end up in intensive care with COVID-19. Under 12, about 3% have been in hospital, but some of these children have been in hospital for what we call social reasons, rather because their mum and dad may be in hospital, and so the child needs to be admitted because there's nobody else to take care of them, not because they're seriously unwell. So we need to be vaccinating teachers. We need to be vaccinating anyone who's coming into the school. We need for parents to be vaccinated. We need older children, age 12 and above, to be vaccinated. And so what we're seeing is often smaller classes. We're seeing classes of children being separated from other classes, so staggering of playtime and recess time. We're seeing the use of masks in many schools, and even down to children at kindergarten level using masks in their schools. Obviously, we reinforce that nobody, child or adult, should be coming to school if they have symptoms of COVID-19, or if they are required to be in isolation or in quarantine because they've been in contact with other people with COVID-19. We're looking at the ventilation in classrooms. Obviously, having open windows is really important, but there are also other ventilation measures which may assist in improving the circulation of air in the classroom. Having some classes taught outside when the weather is appropriate can be increase the safety as well. So there are quite a number of measures which can be taken to reduce the risk of children being infected when they're at school. Yes, so actually country of birth is not routinely being collected when people are receiving their COVID-19 vaccines. So at this stage, we don't have vaccination rates by country of birth. We do have understandings of vaccination rates on the locations where people are living. And as you're aware, we do have some particular locations where there's more concentration of people from different multicultural backgrounds, but we don't have complete understanding by country of birth. But it is absolutely important, absolutely essential that we are getting the messaging about vaccination out to everybody in Australia, whether or not they are fluent in English. And that's the reason why we've been working with community experts, or community leaders rather, from all the different multicultural communities around Australia, because these are the people we know who people are going to listen to and trust, people who can speak in the same language, people who understand culture, people who understand the reasons for hesitancy among different population groups. So it's been really important that we have the vaccines rolling out through general practices and through pharmacies in local areas. And of course, we have GPs and pharmacists of Korean background who speak Korean and who people can talk to and get direct advice from.